I always get them first to look at their toxin exposure as a whole. Because at the end of the day, every small change makes a difference. And one tiny little piece is not going to completely set you over the scales unless your toxic burden is already really high. So the more we can decrease our toxic burden, the more we actually have some flexibility. That's how I look at it, because I don't believe in an all or nothing approach. I don't believe that you have to be perfect to get pregnant. And if going and getting your nails done is something that brings you joy and is a therapeutic experience for you and makes you feel good about your life, there are some benefits outweighing some potential risks there that we have to take into consideration. So at the end of the day, if you're someone who likes to paint your nails and you've made a few swaps in your hair care or your makeup or your skincare, and you've unplugged all of those air fresheners to get all the synthetic fragrance out of the main area of air you're breathing, and you've changed your cleaning products and you store your food in glass instead of plastic, you've done a lot of those fairly basic but can also feel challenging at times, for sure, swaps, then your toxic burden is sitting at that lower level in a perfect world, right? We're not checking your urinary levels of parabens and phthalates, but if we're reducing exposure, we can assume we're at that lower part of our bucket. And if it brings you joy, and I love answering this question specifically because I know why people are asking. They want holiday nails. We want nice nails for Christmas, right? New Year's and all the holiday parties you have to go put a brave face on too. And if having nice nails and nice hair makes you feel like you can handle those parties and not feel like the outcast dealing with infertility and maybe step out of being that version of yourself for the night, then I say the benefit dramatically outweighs the risk in that conversation, okay? Same sort of idea when we get asked this about, can I dye my hair? And I always say, like, well, talk to your hairdresser about what you're using. Lowest exposure is best. So do we want to be going in and getting full heads of hair done, especially right up against the scalp? A lot of times, probably not, like not even for just like your hair, really, right? So lowest exposure is always best. And at the end of the day, I'm going to come back to the nails for a second. At the end of the day, if you can use a more toxic free nail polish, awesome. But if you can't or you don't want to, I don't want you to feel like this is having a negative impact in your fertility journey. And it's just one small piece in a large bucket of toxin exposure. And if we can work on other areas, you still get to have some flexibility there.